Gloves that are put on correctly create a barrier between germs in your hands, and they also reduce transmission of pathogens. They prevent the surgeon and nurse from getting sick, and they also prevent the patient from being infected during the procedure. If they are put on incorrectly, it greatly increases the chance of the patient getting infected with any type of disease.
Okay. So the problem with nurses putting on their gloves is that while the surgeon has the nurses put on gloves, the nurses have to do it by themselves. So what we are doing is designing a procedure or something to help out the nurses putting on their own gloves, so they can do it properly without having to worry about all the stuff going through the old technique.
Our task was to improve the process of putting on surgical gloves to minimize the risk of infection during surgeries. The problem was that nurses have to have a way to put on the gloves themselves so that they can in turn don surgeons. So what we decided to focus on was the packaging of the glove, like the way it's put on, because the nurses are doing it themselves, and so like the simplest way to be able to keep it sterile and at the same time efficient and cheap would be to have a package that made it the most efficient to put the gloves on.
I'm going to take this set of gloves and I'm going to open this up. See my little thing? I haven't touched it. I'm going to open this up. And the most important part of opening every glove is my shirt.
Look at that, actually taking it open.
Okay? So.
Okay, let me try again. Okay, again. I already forgot.
What you want to do is put the glove on your palm with the thumb facing you, and I'm going to start with my finger. I'm going to flip this over, okay? And as you see that, I'm going to take my fingers and my thumb.
We're gonna have to do that again.
Well, you have to put both gloves on eventually, don't you?
Yeah, but I just opened it with the wrong hand. Ready? Here is Glove Plus's latest product. This is our self-donning glove to help all of our nurses out there. So the first thing I'm going to do is open our sterile packaging. Our outside packaging protects yourself and your patient from contamination, so just pull that right out. The next thing I'm going to use is our patented opening tabs. Open it just like so. And the last thing I do is I place my hand directly inside of the glove. I can use these handy outside tabs in order to allow my hand to go smoothly inside. And wiggle your fingers into each sleeve and remove. Okay, so the outer level of protection is our Glove Plus outer sleeve. We place our packaging device and insertion device right inside so that we can keep all of our materials sterile. Our outside pull tabs remain sterile the entire time, so you're okay to use them inside with your sleeves of your gown. And all you have to do is place your hand right in. Your glove is sealed inside of this bag, and it was created in a sterile environment. So everything that you're touching and everything that you'll be using is sterilized, and your hand can go straight in so that you have no risk of contamination.
I'm Toye Banjo.
Good luck in class.
I'm Aric Lu. Right.
I'm Nicole Devitt.
My name is Celine Robinson.
Plus, the most effective way to put on gloves.